Here, I'm going to talk about a clinical case studies. First of all, I'd like to give a thank you to Professor Dr. Janice Batista for her helping hand always. My case presentation here today, a patient named Kamara, she is 49 years old, and she came to the medical center to look for the help regarding an extremely painful swelling on her left leg. She explained that swelling begins 3 days ago, and she also reported bilateral itchy lesion that was diagnosed with psoriasis. So my patient has a known case of psoriasis, and she present with painful leg swelling. She has no history of diabetes mellitus or hypertension. The patient demography, she is 49 years old and she is African American ethnic group, and also she is heterosexual. The patient chief complaint, according to the patient's statement, she said that I have a swelling and redness in my left foot, and affected area was painful painful a day ago, but the pain has reduced. The history of present illness, the patient present to the office with complaint of swelling and redness in the left foot. And she thinks she has an infection on her left foot. Onset of swelling and redness was 4 days ago and does not heal on its own. She has a history of psoriasis that had she has similar symptoms, and she claimed that the problem started after run out of medication. And she, according to her, she also mentioned her pain does not radiate in its other part of the body. Subjective data, current medication, allergic, and past medical history. Medication history, she took triamninolone acetonide ointment. It is very low dose steroid, and applied with thin film of triamninolone acetonide ointment 2 or 3 times a day. Allergies, patient has no allergic to the food or no allergies to medication, environment, or insect. Past medical history, the patient has a significant history of psoriasis that was diagnosed and treated 6 weeks ago. The past surgical history, she has no past surgical history. Personal and social history. She denied use of alcohol, denied drug abuse, and denied present use of tobacco. But she has a 10 years history, and she stopped to take tobacco when age is 8 years old. She is retired elementary school teacher, married 20 years, and live with her husband. She has 2 daughters. One is 30 years old, she's married, and one is 26 years old, she also married. Family history, her father passed away for myocardial infarction, and mother has passed away because of type 2 diabetes, mellitus, and hypertension. So my patient has a strong family history of heart disease, high blood pressure, and diabetes. The health promotion, we check for screening test, mammogram, colonoscopy, pap smear, and mammogram and pap smear test basically done last year, and it was normal. She exposed to laboratory confirmed COVID-19 in 2020. It was very mild symptom. Immunization history, immunization schedule are up to date. Subjective data and review of the system. We go one by one: general, head, neck, ear, nose and throat, skin, and respiratory system. General examination, subjective data, we report the swelling, redness, and slightly pain in left foot and deny any kind of fatigue, nausea, and fever. The head, neck, nose, throat, and ear, patient deny any kind of headache, head injury, syncope, or vertigo. Patient deny any change on vision, deny hearing loss, deny ear discharge or on patient, or deny any kind of tinnitus, swelling, or pain in the throat. The skin reported lesion and itchy bilateral feet. Respiratory system denies shortness of breath, dyspnea, coughing, or sneezing. Cardiovascular, she denied the chest pain or palpitation. Gastrointestinal, deny abdominal or stomach pain, nausea, change in the appetite, vomiting, or abdominal bowel movements. Any abnormal bowel movements. Musculoskeletal system, deny muscle or joint pain, any kind of numbness, deny limitation in range of motion of joints. Breast, deny any change in the shape and size, lump or bump in the breast. Female genitalia, deny abnormal bleeding, any kind of itching or pain when urination. Neurological, deny confusion, delirium, or dementia. Physical examination or objective data include vital sign, general, head, neck, nose, throat, and ear, and also intragomental system. Vital sign, blood pressure systole 134/76 millimeter of mercury in sitting position. Pulse rate 108 beat per minute. Respiratory rate 20 beat per minute. Temperature 98.2 Fahrenheit. Route is oral. Height is 60 inches. Weight is 144 pounds and BMI 28. This is overweight. Saturation of oxygen 97%. General, normotensive, no acute distress, well dressed, calm, and responsive. Head, neck, nose, throat, and ear. Head, it is normocephalic, no lesion, no injuries. Eye pupil is round, equal, and reactive to light. Ear, tympanic membrane, gray color, and no bulging and no erythematous. Nose, moist and mucosal pink. Throat and neck, no lymphadenopathy. Jugular vein not distended, no palpable masses. Intragomental system, dry and warm, severe scaly patch on dorsum, on ankle and left foot. Right foot has moderately scaly patch to dorsum. Redness and worm increase on lateral aspect of left malleolus. No open lesion. Pruritus and scaly and black. Both calf is symmetrical. Respiratory system, the clear unlobuled breath bilaterally, no rale, bronchi, wheezing, and diminish the breath sound. Nothing. Cardiovascular system, regular rhythm, tachycardia, normal. S1 and S2 sound, heart sound is normal, no murmur, no raps, gallops, or S3 or S4 is present, not present. Musculoskeletal system, no muscle pain, joint pain, or patient has a full range of motion for neck, hip, and shoulder. Gastrointestinal, soft, no tenderness, non-distended, no mass, and patient has a positive bowel sound in all four quadrants. The breast, no lump, swelling, or pain. Genital urinary tract, giant urinary tract, urinalysis, and negative result, no UTI. Neurological, patient is alert and oriented to place, date, time, and self. Laboratory and diagnostic test. For my patient, most important is complete blood count. WBC is elevated, means patient has an infection. D-dimer is a normal range of motion, so it is important to evaluate any kind of deep vein thrombosis. ESR, erythrocyte sedimentation rate, is 22 millimeter per hour on the right hand. It indicates patient has inflammation. Diagnostic test, ultrasound of left leg. This is negative for deep vein thrombosis. To study this case, the differential diagnosis, we think about cellulitis of the foot, deep vein thrombosis, or contact dermatitis. My patient already known case of psoriasis, so cellulitis most common or chance of develop. Cellulitis is an infection caused by the bacteria in the food leading to redness, swelling that extend to the toes. And this disease is recurrent and could lead to lymphatic drainage system damage or chronic swelling of affected limb. If it is untreated, it is a complication develop. Deep vein thrombosis is associated with the blood clot that forms in one or more deep veins across the body, particularly in the legs. The condition leads to the leg pain and swelling. Contact dermatitis, the condition occurs due to the allergic reaction when the skin comes into contact with any kind of allergen. But my patient is denied any kind of allergic reactions, and it causes the skin rash in area of contact. The primary diagnosis and assessment. The primary diagnosis for this patient is the cellulitis of the foot. And cellulitis basically occurred as a result of bacterial infection when the skin breaks or due to the trauma. My patient has a psoriasis, sometimes maybe the scratching or itching, and skin is breakdown and started the cellulitis. The infection of the skin spread and extend deep from the skin to attack the subcutaneous tissue. The infection affects mostly the lower extremity like the foot. The patient with cellulitis would demonstrate the symptom like pain, redness, swelling, or food. So typical presentation of inflammation. The patient also indicate the elevated erythrocyte sedimentation rate and mild leukocytosis. WBC is elevated. Assessment from the previous diagnosis of psoriasis is the main cause of cellulitis. Psoriasis is identified to be the cause of lesion diagnosed in case. And this is characterized by red plaque that are thick with clearly defined border that is silvery or scaly featured by psoriasis. And we know that psoriasis is a chronic skin disease, which result is a scaly, often itchy area in patch. And now, what are the treatment plan for my patient or medication? Treatment involve starting the patient on antibiotics, basically clindamycin. Clindamycin 300 milligram 4 times a day for 7 days for cellulitis treatment. Also low-dose steroid, triamcinolone, acetonide, topical ointment. Apply affected area 3 times a day. Also, ultrasound of left leg help to rule out deep vein thrombosis, ensure the left leg is kept elevated, allow the medication prescription strictly for antibiotics. Follow for 5 days. It should be enhancing the re-evaluation of swelling and redness of right foot. Also need to review ultrasound result. What are the other screening tests? Like complete blood count, WBC, should be elevated for this patient. Blood culture, need to find out organism for choose the antibiotics. For she is almost 40 years old, so mammogram is important, colonoscopy, pap smear. My patient already done pap smear test last year in October, it was normal. Mammogram also done last December 2021, it was normal. Other test is important: blood pressure monitoring, cholesterol monitoring, diabetes or hemoglobin A1C, blood sugar level, eye exam, and dental exam. Other assessment, referral, no need to refer this time. Patient health promotion, reduce use of sodium salt to reduce the risk of edema and increase the physical activity or exercise and proper balanced nutrition. Disease prevention, to ensure the proper wound hygiene to prevent further infection of redness and swelling. For my patient, need to the follow-up. Averagely after 5 days, the patient is supposed to come to see the improvement after use of antibiotics. What are the education need for my patient? Keep the affected area dry and clean, take medication as prescribed, and raise the affected leg above the heart level, provided education on medication's adverse effect, including any kind of complication of MI, gastrointestinal bleeding, pancreatitis, kidney or liver failure. Also discuss the sum of medication's common side effect for the patient, like headache, dizziness, diarrhea, constipation, rash, or treatment. So if we discuss side effect, or patient will concerned about this. Anticipatory guidelines, nutrition and diet counseling is important for my patient. Also taking medication as prescribed, follow the dietary recommendation is important. Weight management, reducing weight through the proper physical activity and diet medication, consuming the fewer calorie, more vegetables and less fat will help overall health. My patient is already overweight. Staying compliant with routine follow-up, blood work, and preventative scanning such as eye and dental follow-up, immunization keeping updated. What are the roles of nurse? So nursing care plan for the client includes nurse practitioner or healthcare provider conducted to assessment of the risk factor for the patient, courage to the patient to adopt the skin care routinely to decrease the skin irritation. Also, encourage the patient to avoid aggravating factors like sun exposure, smoking, or any kind of stress. Also, discourage the patient to scratching the lesion. Now, what are the incorporation of current practice guidelines? Basically, we prefer the art and science development practice in nursing and interprofessional approach. What is Potter and Thomas, and also Butero by primary care, collaboration practice, 4th edition we prefer, and also practice guideline for family nurse practitioner we followed. And here is also our references, and thank you.